My name is Gina Diarco. I was in the United States Public Health Service for 2.5 years. I'm at the rank of 03 lieutenant, and I've been coming to the VA in Philadelphia for approximately 2.5 years. I was introduced to this type of measurement in group as well as in my individual sessions, my therapy sessions, and it only takes a little bit of time, but the information that you gain from it seems to be well worth that little bit of time that you spend, and it helps to direct your session to the important things that you might not bring up on your own. And I think that is really the most valuable part of this whole process.
My name is Dr. Johanna Klaus, and this is my Philly VA. Hello, my name is Johanna Klaus, and I'm a clinical psychologist at the Corporal Michael J. Crescens VA Medical Center in Philadelphia. The implementation of measurement-based care can improve the effectiveness of care provided to veterans. Measurement-based care refers to the use of self-assessments, biomarkers, and other measures as a way to individualize treatment. For example, taking blood pressure to help guide the treatment of hypertension. In mental health treatment, measurement-based care most often refers to the use of patient-reported outcome measures, such as the PHQ-9 or the PCL, that are collected in a planned way during the course of treatment and used to inform clinical care and guide shared decision-making in ongoing treatment. Studies have shown that adding measurement-based care can substantially improve clinical outcomes. Routinely using assessments as part of treatment can help personalize care and guide treatment decisions, can help engage the client as an active partner, and can help improve communication between collaborating providers. But how do you do it? How do you add this to an already packed appointment? Will the veterans be willing? This video is a demonstration of how measurement-based care can be effectively incorporated into a mental health session. Dr. Christina D. Chiara is meeting with a female veteran she's been treating for post-traumatic stress disorder and depression. This is a reenactment of the beginning of an actual session, so these are their real identities. They are not actors.
Okay, let's set our agenda for our session today. First, let's start out by taking your temperature and having you fill out the questionnaires about your most recent symptoms. Okay. We'll look at the results together, and then we can talk about homework and develop a plan for the rest of the session. Sound good?
Yeah.
Okay, I have this all queued up. Just take a moment to fill it out. Let me know if you have any questions.
Okay.
Measurement-based care has been valuable to me in my treatment because it allows me to see concretely the changes in my symptoms. And I can look back on the last week or two and figure out which of the events that have occurred has, caused those changes, whether positively or negatively.
Okay, great. Any questions?
No.
Okay. Give me a moment to sync this and we'll look at the results.
Okay.
Okay, so let me pull up the graph. All right, so this is the graph of all your depression scores over the time of us working together. This one is today, and today, if we scroll up, you can see your score is a 16, which is in the moderately severe range. And your score the last time we met was a 20, which is severe. So it looks like there's been a little bit of a decrease. Does that feel true to you?
Yes.
Okay, tell me how you make sense of that.
I think because I've been sleeping a little better.
Okay, so
That's definitely made a difference in my mood.
yeah, I can see how that would make you feel better. Just thinking about where your scores are, where your symptoms are today in the context of your depression over time, It looks like definitely a decrease from before and a decrease from when we first started working together. A little bit higher from when you ended the behavioral activation group. That's when your scores were at their very lowest.
Yeah.
Does that feel true to you in the ups and downs that you've had?
Yeah, it does.
Okay, great. I also want to look at the answers that you gave to those questions. Okay, so trouble sleeping more than half of the days, that's less than it was last week.
Yeah.
And I'm also noticing to the question about suicide, you said no suicidal thinking in the past week or so.
Yeah, that's correct.
Okay, that's true. So that's an improvement as well. Let's plan on talking about how these improvements have been made, what you've been doing this week, and how we can keep it going.
Okay.
Okay.
I hope you found this a helpful example of measurement-based care. This is, of course, just one example, as there is no one right way to do this. Notice Dr. DiChiara used a tablet to collect the assessment data. Use of technology, while not necessary, can help make the process more efficient. Including measures in care does require a shift in time and effort to get started and into the habit, as does any behavior change. I hope you feel it's worth the investment. Thanks for watching.
I'm Gina D'Arco, and this is my Philly VA.